Good morning once again and welcome to Breakfast Extra. It's time for the big report segment, our very first big report for today. And today we're heading to Borno State. We're facing a public health crisis exacerbated by recent floodings. A cholera outbreak has gripped the state with hundreds of cases already confirmed and spreading fast. Health authorities have confirmed at least 17 cases in the capital, Maiduguri, but the overall numbers are alarming, with 451 cases now reported across the state. The devastating floods have left many areas vulnerable, overwhelming sanitation systems and contributing to the rapid spread of the disease.
Now, efforts to control the outbreak are underway, but with widespread displacement and contaminated water sources, the challenge is immense. Local health officials are scrambling to contain the situation, while relief efforts struggle to reach the most affected areas. In today's report, we will examine with our News Central correspondent, Umaru Kirawa, who will be joining us, the combination of environmental disaster and public health emergencies that have pushed or that have caused this cholera outbreak. Joining us now, we have with us Gerilda Birukila, UNICEF Chief Maiduguri Office, who's joining us. Gerilda, you are welcome. Thank you very much for joining us this morning.
Thank you.
And of course, we also have Umaru Kirawa, who is our News Central correspondent that filed in the report. Umaru, you're welcome. Good morning to you.
Umar, first of all, good morning. Let me start with you. You are the reporter who brought us the report. I mean, how difficult was it, just, going on ground there, and just give us a situation as far the water sources and how, the water, the flooding has affected the sanitation and sanitary equipment in that area to have caused this current state of emergency regarding the cholera outbreak?
Yes, to take us to memory lane, the 10th of September was the day the flood occurred. It caught people unaware during the night time. And of course, people are not ready and not even aware of the incident. So it's a sort of emergency where so many things happened, so many people lost their lives, and so many people were stuck, so many people were rescued, so many stories to be told with regard to the flood disaster. And talking about the incident of the cholera outbreak, even in the onset of the flood disaster that devastated the state, the government was aware of an possible incident of outbreak of diseases, and even health partners, the UNICEF, the World Health Organization, UNFPA, and others alike were aware of possible outbreak of diseases. That is why some of them even donated some kits and cholera vaccines, even from the federal government to the state government, in order to tackle the situation. However, it was unfortunate that some cases were recorded. Over 400 cases were suspected cases were recorded, and people are battling now with what to eat, how to survive, and of course, for women particularly, the issue of sanitary kits or sanitation and hygiene is a very big problem in this issue. And the flood contains so many things inside, diseases, good things, bad things, a lot of things. So it causes a very serious health concern. At the onset, we've had announcements or jingles with regard to people should start avoiding meat, because some unscrupulous elements were even animals that died during the flood were sold within the Maiduguri metropolis, which the government says people should avoid, and people should avoid vegetables. But unfortunately, people are struggling to survive. Their houses are down. They have to eat what they see. So possibly it led to the outbreak, and this is the situation that people are struggling with now.
Mar, many thanks for just capturing that. Let me turn now to our second guest here. You are part of the local response, to this outbreak and also to the flooding by extension. Let's ask what the response has been like, and how you are just coping with all of the side effects and, for example, this cholera outbreak, or just on the sidelines of the aftermath of the flooding.
Yes, thank you. So currently, UNICEF, government, other partners, we are responding to the cholera outbreak. And like my colleague mentioned, we actually expected this. Once you have flooding, some waterborne disease and other disease, for example, the number one problem for now, I've been in the camps even yesterday night, is malaria. And we are having very severe malaria because of mosquitoes. The stagnant water has allowed, the multiplication of mosquitoes, and malaria is really a serious issue. But with the cholera, we have prepared and we have treatment. As you have said, we have been really grateful right now. Till today, we didn't have any mortality. This shows that the management of cases is very good, because the death from cholera really can come from lack of management.
All right, Garilda, I've got a question regarding the disease and how it's transmitted. First off, we know it's a waterborne disease. And we also know that the flood is moving to other parts of the country, it's flowing toward the delta. Could we expect more of this disease as the water goes along the path which it's flowing currently?
Yeah, so with the floods, there are a few things that you must expect, because especially cholera is part of it anywhere in the world. Waterborne disease is really expected. Also malaria, yes. I was also responding to other countries that were severely affected by floods. And we saw that malaria, in fact, ended up killing more people than people who were killed by the actual floods. And we know that in Nigeria right now we're experiencing outbreak of cholera in several states, including those in neighboring Borno, Yobe, for example, Adamawa, Niger State, which is very like Suleja, which is very close to Abuja. So I think it's very important that people prepare, especially making sure that the hygiene promotion, water is treated, making sure also that you have enough supplies like medicine, antibiotics, personal equipment like boots and gloves, beds, so that you are not overwhelmed. For now, we are supporting really this kind of case management. UNICEF has really given a lot of medicine, beds, tents, and soaps, water. And we are working with the government, as I mentioned, to ensure that we are not overwhelmed. But flood, no one can be really 100% prepared by flooding. So it's really important that whoever is affected, we are able to come together and support them, regardless where they are or whom they are, because no one can be 100% prepared. So in order to save lives at a quick rate, it's best that we put our efforts together so that we can reach as many people as possible, and also we can prepare people as much as possible.
Thank you, Garilda. Umaru, let me come back to you. Umaru, what's been the response from the government or the Ministry of Health? Have they been helping people or the residents get access to clean water or anything else? What have they done?
Yes, first, not only the Ministry of Health, because it's a multi-sectoral approach. The Ministry of Water Resources of the Borno State government, we've seen them making an announcement that any community that is battling with their boreholes or their sources of water supply, they should notify them so that they will repair them. And the good news, in fact, is the state government yesterday inaugurated a committee to assess the level of damage of the Alo Dam and look into the possibility of addressing the issue of water shortage, because up to now there is spillage at the Alo Dam, which the government has inaugurated a committee, and we hope the government redoubles its efforts in taking steps so as to avoid other catastrophes like shortage of water, clean drinking water, and so on and so forth. So by and large, but Ministry of Water Resources, the Ministry of Health have announced the resumption of over 300,000 vaccines of cholera, and they have raised concern with regard to what people should do, what they should avoid, and they should try to comply with health tips and so on and so forth. So it's good that the government is responding, and of course, not only the government, but development partners, like I've said earlier,
right.
UNICEF, World Health Organization, Save the Children, and so on and so forth.
Right. Umaru, my final question for you as we're about to wrap up this conversation. What's the current state of the flooding in the region? What's the update as the water started to recede? Are people returning back homes? Are people back to rehabilitating and, rebuilding their lives? What is the update?
Yes, the update is that in some areas, the flooding is gone. But in some areas, even the renowned College of Agric now, water is still there. However, the government inaugurated a committee of relief, and they are assessing some of the communities, and they are providing support. It will not reach all, but they have started reaching out, giving cash assistance, food, and other items like blankets and so on and so forth. Although it is not enough for the people, but the government thinks at least it will go a long way to address some of their concerns. But by and large, people are in a very sorry state, and they are grappling to survive because they have lost their means of livelihood. Farmlands were lost. In fact, this is one of the greatest challenge which the government need to step up efforts in utilizing some of the waters for irrigation, so as food security will not be another catastrophe that will destroy this part of the world.
All right then. Garilda, final question, and if we can keep this short. Regarding the path of the water as it moves towards the delta, what advice do you have for the Nigerian government and residents within that path?
Yes, so first of all, Nigerian government works with the partners to identify areas that are possible, for flooding, and they advise the residents, for example, to move. So the first thing is to save lives, that people are not caught up. If they are in the path of the water, then they need to move to a safer place. And that may not be the most comfortable, but it's best to be safe rather than really face the water. But in terms of preparations, I needed to mention that in Borno, for example, we are receiving today 669,000 doses of oral cholera vaccine. And I think in terms of cholera, the vaccine is going to help a lot in stopping transmission. So I think people need to pre-position supplies, making sure that, they can have shelter, they can have accommodation, and they can identify places that they are able to be, especially in terms of water, food, and also to look after the elderly, the young people, especially children and women, and especially also pregnant women. It's best to really prepare to ensure that we can really minimize suffering if we prepare well. Thank you.
Well, I want to say thank you to you, Garilda, as well as Umaru there for just bringing us update on this. We'll definitely keep following this story and just to make sure that the number of cases reduce, within the 1 week, and also that people heed to, healthcare advice and just stay safe and try to consume or try to make sure that their source of water is as clean as possible. Once again, many thanks for joining us. We appreciate you for doing this with us this morning.
Thank you.